Let's begin with the first section of our lecture, which will be the prostate cancer. And in this section, we will discuss the benign and malignant changes in the prostate. What is the epidemiology of prostate cancer and some protective factors for the development of prostate cancer, and how we can prevent the prostate cancer. So let's begin with our first section. And if you see here in this diagram, this is the normal urological picture of the male, and this is the bladder, urinary bladder, and then the urethra. Urethra is the opening that carries the urine from the urinary bladder to the outside. And surrounding this urethra here, this is the prostate gland. Prostate gland is present only in males. Females don't have the prostate gland. And in this picture, if you see, this is the prostate gland that is hypertrophied or enlarged as compared as the normal walnut-shaped prostate gland. And this is the hypertrophied prostate gland, and it's close to the urethra. So when the prostate gland enlarges and hypertrophy, it puts pressure on the urethra that leads to the backflow of the urine also. And you can see the bladder is also full of the urine, and this causes the urinary retention also. And then when we talk about the symptoms and signs of the prostate hypertrophy or prostate cancer, we will discuss what are the different symptoms. And mostly these symptoms associated with enlargement of the prostate or prostate cancer are also due to the pressure effect of the hypertrophied prostate gland that put pressure on the urethra, and it causes backflow of the urine. The urine outflow is decreased, cause dribbling of the urine, weak stream of the urine. So all those changes can occur with the enlargement or with the changes in the prostate gland. And this benign and malignant changes in the prostate, it increases with age. As the age increases, the chances of developing prostate disease is increased. When autopsies of men are performed, usually there are enlarged hyperplastic and malignant changes in most of the cases in the elderly male patients. And there is, again, it's more prevalent amongst the elderly. So as the age increases, the chances of developing prostate hypertrophy and malignant and benign changes increases. Benign proliferative disease, or BPH, which is benign prostate hypertrophy, usually the symptoms produced by the hypertrophy or proliferative disorder of the prostate, they are weighted against the side effects. As I mentioned, more is the increase in the size, more worsening of the symptoms that are present. And then there are some complications that can occur as a result of intervention of prostatic hypertrophy or proliferative disease of the prostate. So it can lead to some complication as a result of intervention. Then the prostate malignancies, usually the prostate malignancies, the risk of developing disease or death from cancer balance again different morbidities. So both factors, if it will lead to development of the disease, or it can cause the death of the patient with the prostatic cancer, both vary according to different morbidities. So it weighs against different morbidities. So proliferative benign prostate hypertrophy symptoms depend on the size of the prostate, and also there are complications that can occur as a result of intervention. And then we have prostate malignancies, where we have risk of developing disease or death can occur depending on the as it's balanced against different morbidities. The anatomy of the prostate gland is present in the pelvis, and it is surrounded by rectum and bladder, periprostate and dorsal vein complexes. So the prostate gland is present in the male pelvis, and it is surrounded by the rectum and the bladder, and it is also surrounded by the periprostatic and dorsal vein complexes. Here, if you see in this diagram, it is surrounded by, this is the prostate gland, walnut-shaped prostate gland. Then we have the rectum. This is the rectum, seminal vesicle, base of the bladder here. So surrounded by the bladder and the rectum, base of the bladder. Then the urethra, corpus cavernosa and corpus spongiosum. So these are the different structures that anatomically present close to the prostate gland, or it surrounds the prostate gland. The components of the prostate, we have tubuloalveolar glands, acinar unit, stromal compartment, which is fibroblast and smooth muscle cell, prostate-specific antigen, prostatic acid phosphatase, and conversion of testosterone into dihydrotestosterone. So these are all the components of the prostate, the tubuloalveolar glands, which produce the secretion that helps in the transfer of the sperms. Acinar unit, then we have the fibroblast and smooth muscle cells, prostate-specific antigen, which you will see later on in the lecture, that is very, very important for the diagnosis of prostate cancer. Then we have prostatic acid phosphatase and conversion of testosterone into dihydrotestosterone occurs in the prostate. Then the prostate cancer, again, you can see this is the bladder, urine. This is the prostate cancer present in the prostate gland. And as a result of that cancer, the urethra is compressed. There's the compressed urethra, and that is now showing the backflow, or the urine goes back, because the urethra is the outlet for the urine from the bladder. So when that urethra is compressed or blocked, there is backflow of the urine into the bladder. Prostate cancer epidemiology is risk increases in first-degree relatives affected. So if first-degree relative is affected, the patient will have more chance of developing prostate cancer. So it has hereditary factor attached to the development. Can be hereditary, affects ethnic groups differently. Hypermethylation of GSDP1 gene is present in prostate cancer. Then we have polymorphic variants of AR, cytochrome P450, C17, and steroid 5-alpha reductase type 2. So all these are different variants of the prostate cancer: AR, cytochrome P450, C17, and 5-alpha reductase type 2. So it increases with the family history, first degree relatives. If it's present, the relative will have a more chance of developing it. So it's a hereditary factor, affects the different ethnic groups differently, and there is hypermethylation of GSDP1 gene. The high consumption of dietary fat increase the risk of developing prostate cancer. So more fatty foods increase the risk of the prostate cancer, like it increased the risk of the colon cancer. Prostate cancer is also associated with high fatty diets, so more fiber diets are very important. More consumption of fruits and vegetables is good for the prevention. Protective factors, consumption of isoflavonoid, genistein, intake of cruciferous vegetable, intake of retinoids, lycopene, and inhibitors of cholesterol biosynthesis like statin and drugs. So all these are protective factors for the prevention of prostate cancer. So consumption of certain foods are more healthy as compared to fatty foods. So fatty foods should be avoided. Red meat as a fat, other fatty food. The consumption of more vegetables is very, very good. And intake of retinoids and inhibitors of cholesterol synthesis, statin drug. So drugs that are used for cholesterol, lowering the cholesterol level drugs are very, very effective. Prevention, again, this is the prostate gland. This is the normal prostate, and you can see the prostate with the tumor. No drugs or dietary supplements are approved for the prevention of prostate cancer. The prostate cancer prevention trial is available, which is the statins, some protective effect. Then we have 5-alpha reductase inhibitors, which is the likely therapy. Dutasteride inhibits both type 1 and type 2 5-alpha reductase inhibitors. And then we have finasteride, which shows reduction. So these are some methods or preventive steps we can use for the prevention of prostate cancer, but there is no specific supplements available that you can use and say that you are now protected against the prostate cancer. That's not the case, but there is a prevention trial. We can say that's a prostate cancer prevention trial, which includes the substances like statin, 5-alpha reductase inhibitor, and then we have finasteride, and then we have dutasteride. So all these are different supplements, we can say, that can be helpful for the prevention of prostate cancer. So that was all about the section 1 of prostate cancer. Thank you for watching sqadia.com.